I think they should ask for very large randomized control trials. The effects of this on sleep aid is probably modest and kind of dependent on like preference and individual differences, as we discussed. So studies will need to recruit a very, very large and diverse sample. And recruiting a very large and diverse sample will also help us run more analysis on like who benefit, when, and for what type of sleep disturbance. We also need to know a bit more about the characteristics of like what is the active ingredient of one of these sleep tools. For example, for sleep story, does the content matter? Does the way it is narrated matter? Or the rhythm in which the person speaks is like, do they usually go a bit slower? Do they go a bit faster? And how much all this is also influenced by just preference and maybe cannot be easily measured and quantified. And then another quite significant limitation of this type of research and like mental health apps and wellness apps in general is that usually the interventions are measured against a passive control. So, for example, waitlist control, and we know that that might inflate a bit findings. So, test them against some sort of like credible active control condition will give us better results. And then ultimately, I think, yeah, we just need research, not just to know if these are effective, but for whom and under what circumstances.